Hi, I'm Peter.
And I'm Paul.
Welcome
Welcome
to
to
the
the Twin
Twin Perspective.
Perspective. Okay, I know it's been a minute since we had a recording, so good to have you back here, Paul.
Yeah, same here, Peter. It's been a minute. I know life has been lifing. It's been very busy, but it's great to have you here too.
Yeah, we're trying to just do what we can to still keep this momentum going and making sure we're still passing the messages out there. So today's topic is something I'm very passionate about, and as Paul knows, I always speak about this, even right from nursing school, about men in nursing and how this role could be very gender specific sometimes based on assignments. I did experience something at work, and it was more like, hey, they're trying to move a patient, and they're calling over you know, the walkie and saying, hey, can we get men to for lifting assistance, like male nurses for lifting assistance? And I'm like, wait a second. Wait, I don't like that sound of that. I don't like the sound of that. I feel like I appreciate if you ask for lifting assistance. Just
Okay.
use a more inclusive term and let people that are willing or feel like they have the strength to come
Mm,
and do it. But
mm,
you saying you want just men, you eliminating other genders and other people that are willing to do it because you're saying we don't need you, we need this man.
mm.
Or part of me is like, first of all, who says all men can lift? We're going to talk about and just see if other people are experiencing this, and the ones that are not experiencing it, have they heard about it before?
Just a quick. So I hear where you're coming from. I hear the pain points that you actually have in terms of is it like a segregation in the job role for men and women in nursing? Meaning that during our training, there's no specific gender associated to, oh, you have to do this as a woman in nursing, and you have to do this as a male in nursing. We're all
Correct.
trained to do the same thing. So when
Correct.
it's time to actually practice, you should do what you've been trained for. Is that what I'm hearing?
Correct. Correct.
Mm,
That's what you're hearing. We all have the same training. We all have the skill set to move patients, but it's just the fact that we've been trained in our, like, the way we grew up. The men have more strength. The men are to do the heavy lifting. The men are to do, things that require, like, let's say you have, and another thing that happened again, you have a patient that is more like a psych patient, you
mm.
know. Oh, put a man over there so he can handle him. I'm like, wait, why are we the ones that we have to be the ones experiencing the trauma or the beat up, or and I understand the fact, and I tell people
Okay.
when we're at work, right, don't see the gender, see all of us as professionals.
Mm,
Do you get what I'm saying? So we're not assigning, it's not a gender specific role. The first thing first, men in nursing, we're already the minority in nursing.
true.
So now let's say I'm the only guy at work, right?
Mm,
And I have my own assignment already, but they need listening assistance in room 4. They call Peter, listening assistance in room 4. I run over there. I'm the only guy over there. Listening assistant in room 8. Peter runs over there too. Because I'm the only man on the shift, I'm gonna get burnt out because, oh, I do the only lifting.
mm.
Ask for help. I'm all about asking for help, but just don't make it gender specific when you're asking for help. And a thing I told somebody, I said, in as much as we have minorities now as female physicians, when they approach a patient, even though they have a big badge that says probably physician or provider or APP, the patients automatically think, oh, they're nurses.
Mm,
And that's the same way I feel they see the guys also. When they see
mhm.
guys also, they see strength. And I'm like,
Mm.
you know what? Not all guys could actually do all the lifting, okay?
Sometimes actually women can actually even lift more than some men.
Exactly. Exactly.
I do
Yeah.
hear you because it's not about the muscle mass sometimes. I think
No.
what they actually teach us is the skill set, not on how to. But if I should actually also look at it from the perspective of the people calling, the male to come do some assistance.
Mhm.
Now, logically, if I see someone who I feel the weight is a bit, maybe I need like a man job, I think it's been labeled that if something is hard, it should be associated to a man job.
Correct.
Now, not all females even like this. It's not preferable to them because it seems like, you're saying you're not fit to do this. When we go into the profession, it's like going, even if you're going to fight the war, or and you're a soldier, it's like a soldier is a soldier. You do, but again,
Exactly.
true. But if you look at it, do you think, now I'm just saying, because you're
Mhm.
practicing more than I am now,
Mhm.
do you feel, apart from the old segregation, do you feel there are actually some roles that men can do that would make it faster than the female struggling to do it?
I'm not gonna use the word maybe a role a man can do or a female can do. So
Okay.
we're gonna be very open
Okay.
with gender and not being gender specific,
All right.
because right now there's so many, like we have different sex, different genders,
True.
and now you do not even know, and that's why I feel like
Mm.
we're all fighting for inclusion. We have to remember that
Okay.
we
Yeah.
all want to be inclusive. We all want everyone to feel like they're involved in it. Let people be the ones to say, hey, oh, this is not, I can't do this. Let's find somebody else. But the point right now is not even that. The point is, if the resources and the training for lifting or for moving a patient is being given to everybody, that's an open field. Like it's a what am I call it? It's a level field for everyone to
Mhm.
participate in it.
Yeah.
So let's say management says or leadership, they've trained you in how. So it's not by strength, it's skills, you
Hmm.
know?
Hmm.
So people feel like it's strength sometimes. You could be strong, but move the patient wrongly, and that affects your back. But if the proper skills are being initiated, then you could do it right without you being gender specific. So to your question, we have men,
Hmm.
right, in nursing.
Hmm.
And I'm glad that we're part of the percentage of men in nursing, even though we're minorities in nursing. However, there are people that, let's say now, and I'm going to be very open with this, that maybe they transition, like, let's say transgenders from female to male or from male to female. You don't know that. So you're just looking at it from the physical view of it, right? I might look really chubby and have muscle, but I ain't got no strength because all I do is just lift weight, but I ain't got no stamina, right? It's just not judging by the cover. That's what I'm just trying to say. Don't judge by the cover. And I was gonna ask people, I'm like, what if they say
I, I,
because
I do have a question for you on that, okay?
okay.
Because right now, what's going on in my mind, I do hear, what you're saying, but is
Mhm,
there a place, again, which I've heard before, that
mhm.
sometimes even the male nurses, they get more money than the female nurses?
See, if you find that place, Paul, let me know because I feel like that would be something that everyone's gonna say no to. If we're getting a job and they
Mm.
say, oh, men get $2 more
Yeah.
than the other genders, I feel that would be something that you're gonna put in that bias, right? Because you feel like, why would they get more? No one's saying because when you get your job description, it's the same thing for a registered nurse, the same
Mhm.
job description. For LPN, it's the same job description. For CNA or PCT, you all have the same job description, not minding what role or what gender you are. So why can't we all be trained the same way and all put in our strength in doing our jobs? So one person doesn't feel burnt out or the other person doesn't feel like they're being overused and we're all getting the same pay.
So, where do you feel this pain point is coming from? Is it the nurses themselves asking for this, or you think it's the leadership who has delegated that if this is, like a psych ward, for example, and the patient is a bit aggravated, you need to send a mail to the person, or if it's heavy lifting, you need to send a mail to this. Because if you're doing the shift or the allocation, how does this work?
So it's not, I'm not going to start with leadership. I'm going to start with what's been in existence culturally, how men have been seen as the strength and they see the other gender as more of the caring part and the frail part, which is
Mhm.
not. And I'm going to say on social media, you still see some, the other gender, the female sex beating up some men, you know.
Yeah, yeah, that's true.
So
That's true.
how would you classify that now? So if someone wants to carry somebody else, like helping lifting, would I pick the lady that could beat up a man, or I'll pick the man that can? You get what I'm saying? So you have to look at, but it's we still being set in the old ways, and the culture believes that when it comes to being strong, it has to be a man.
Oh, man, exactly, exactly. I was just checking while we're talking now because I realized that there's a myth that people always think that men actually earn more than female nurses in the profession.
Hmm.
I thought about this.
Okay.
I also had this in my mind before that was true. But what I realized is, in as much as there's a possibility that men can actually earn more, it's not due to the job role. It's more on maybe the family time. Men, they might have more flexibility to do more shifts, or they might be able to negotiate better for their salaries than a female. And I also think that's a misconception because that thing has changed. Now we have women more driven, but getting their salary, negotiating better. So there should be that balance in that pay role. So just to clarify that.
Well, yes, and I totally understand that. I'm trying to be very, in as much as we're trying to say this, I'm trying to use the right words because I'm really big on inclusion, and
Mhm.
I want everyone to feel included. Despite the sex or despite their orientation. My point is, it does not matter what your sexual orientation or your gender is. It's all about if leadership or management or the hospital or wherever you're working at provide the resources needed for you to carry out a function, such as lifting, such as moving a patient. And if there's a proper training for it, then it does not require strength. It requires skills and practice. So that way, everyone feels like they can do it. So you do not need to call a man that works out 5 days a week or 3 days a week because he's got all muscle to come do it. You feel like you competent enough. The resources have been given. You've gotten the you've gotten the training to do it.
Yeah.
So instead of taking, you could call for assistance and say, hey, we're doing nursing, like to scoot a patient up.
Yeah,
You need
yeah,
two
yeah,
people
yeah,
to do
yeah.
it.
Right.
It doesn't necessarily mean it has to be two powerful people.
Because
Just two skill.
it shouldn't be based on strength. It should be based on skills.
Exactly, and that's what I'm trying to say. So I'm really hoping that leadership and management, could see this also and train nurses or LPNs, whoever, to learn how to do more skilled work, so that they're not relying on the minorities to come do it. And because the question is, if there was a shift that you had, which happens, and there was no male nurse present, would patient care be affected or would they still carry on?
They'll carry on for sure.
Exactly. And that's my point. So we can still do things, but now because we want to save our backs, we want to save our, if we have the proper skills, the skill sets are given.
The skills and the resources needed.
Correct.
Yeah.
Exactly. Then that's going to make it just, great for everyone. So
Okay.
that way, I don't get Peter. Can I get you in room 4 to come lift a
I do
person?
have a question, Peter. I do have a question
Yeah.
because, well, not a question. I think it's more on a contribution to this from my side because I feel that when you have this leadership say this, it also needs to be ingrained in the people who are actually carrying out this practice because subsequently I might just feel like, oh, a man is around, he should do this for me, And also for the men, if they're on duty and they see lady or female trying to do something and they're like, oh, I can help you with that. Now are you being a gentleman or asking taking a lady's responsibility? Because not even all ladies will like that because they don't, you make them feel like they're not capable of doing what they feel like
Exactly.
they do,
Exactly.
you know?
Correct.
So again, I think from the leadership side, it should also, be known to the nurses that let people take responsibility for if they ask you, for help, you can give it to them. But
Correct.
don't feel you need to do that because you feel they don't have the strength to do it.
Paul, thank you so much. And exactly my point. I'll definitely offer help. I cannot see another coworker struggling or ask for help. I'll jump in because the first thing about working, it's teamwork. We have to work together as a team.
Mm,
And if you feel like your skill set could actually help somebody else more, jump into it. However, it should not be a standard to say,
okay,
this is it.
got you.
So let's not make it a standard to say, meant for lifting assistance, meant for this. That should not be a standard. That should be, if you call for lifting assistance, call for help, and let people that are willing or people that feel like they can do it come in. But when you're so gender specific, you're eliminating all other genders to come help. Even the ones that want to help, you're saying, oh, don't come. So that's where I have the issue. Let's all, how they say that, inclusion, we're fighting for that, right? Let's all be inclusive and say, I call my so let's just use an instance, right? I'm trying to do a Foley, right? And I'm like, oh my god, I can't find this one, this is complicated, right? And I have a friend, I'm like, hey, let's call my friend's name Sandra.
Hmm.
I'm like, hey, Sandra, can you please help me out with this
Right,
Foley? In my mind, I'm thinking she should know more about that, right? But that's also me being assumptuous about it because
right,
she might
right.
not, you, you
Correct.
know,
Yeah,
because that's not
that's
our own
all
body.
right.
That's different. Our bodies are different. But I'm
That
assuming because but I'm still tapping somebody else. Then she comes, we both struggle together, right? And we do it. However, am I being saying because she is a female, she should know how to do it better? So it goes both ways. And it still goes back to the skills. If the skill
exactly,
set is being
exactly.
leveled and everybody knows how to put in a Foley in all genders, I'm not calling that same gender to come do a Foley because I know how to do it.
Yes, absolutely. Okay. I think this is very clear in terms of how we've spoken about it. I like the insights you've given. I like the Foley one. I like, for me, it's actually also making me think of things in a different way because when I was practicing too, it was more on, if a lady, you're like, oh yeah, I'll step in on this, I'll step in on that. And again, this is a different topic, but again, it's that men should also know their limits and not feel because you're a man, it makes you,
Obligated.
you're obligated to do those things. If
Correct.
you cannot do it, because you're a man doesn't mean you can do it. Sometimes we should also learn to say, I'm not sure I can do this, or this is saying saying no is not a bad thing sometimes if you know it's not you're not able or capable to do it. So Peter, thank you so much. I think this was really great to hear that insight from you and the practice of what you've done, and me also sharing my own little experience of my own bedside time when I had that issue happen also. But thank you. That's really great.
All right, Paul. Well, I guess I'll be seeing you shortly in London, right?
Looking
All
forward to
right.
that. Looking forward to
Okay.
that.
All right.